All right, this video is going to be going over how to properly use the back brace that has likely been given to you because you've experienced a recent car accident, slip or fall, or you have chronic back pain that is in need of some support while we work on rehabilitating the muscles that actually support the back. So once it comes out of the package, you will see that it extends out, and this is what it looks like, okay? Depending upon your size, you may need to reposition it some. So the Velcro on the inside right here opens up, and you can slide that up or down in order to tighten or loosen as needed to fit you properly, right? So once you get that fitted, we want to place it here. I always like to have the Everlast logo facing up because we know that's the right side up. And when positioning this, you want to locate those two little indentations down at the lower portion of your back, right where your hips start, below the lower back. All right, and when you do, you want to place the bottom portion of the back brace right on that portion, right? So you do not want it all the way up here, and you don't want it down on your butt. You want that bottom portion to fall right there and cover that, which is called your SI joint, sacroiliac joints, and that's going to give you the support that you need. So once you position in the back, you're going to go ahead and tighten the Velcro here. You want to get a nice snug fit. It should not be super tight because we're going to do more tightening here in just a moment. So once you have that in place, you should start to feel a little bit of security there in that lower back. In order to do more tightening, you're going to take these two little Velcro straps here, take them off, and then you're going to pull them. And as you pull, you're going to notice that it tightens up around your waist. So you pull to the tightness that you desire. You bring it across, that Velcro is going to stick there. Bring it across, that Velcro will stick right here, okay? So now the back brace is on, it is secure, and this is going to give you the support that you need. If the back brace needs to be extended for a larger patient, if it does not fit in its standard form, we do have this extension piece that will allow for more room within there. So we want to take the rough edge of the Velcro, and we're going to take this portion where the soft edge of here is, and we're going to stick that right on there, okay? Now what happens is on the other side we have the rough edge again. So now basically that just gives an extension. We still want to set it up the same way. Find the lower portion of the sacroiliac joint, sit that bottom portion right on top of there, and then for a larger patient, then we'll just come around and that will Velcro in place as before, right? So obviously I don't need the extender, I got a lot of room here. However, that is how we use the extension piece in order to make that back brace fit. So a couple of things to remember. The back brace is to be used in order to give support for the back when the muscles are not strong enough to do so themselves. A couple of things you want to remember. You do not want to drive with the back brace on. It is primarily to be used when you're having to stand, walk, bend, or lift in excess, because it is going to put more strain on the back, and the back brace will come in handy to help to protect those muscles and take some of that pain away. If you sit all day at work and you experience significant pain while you're sitting, you can use the back brace while sitting, but we do not want to do that for extended periods of time. So the back brace should not be worn for longer than 6 hours at a time. I actually recommend that anywhere between 2 to 3 hours, you take the back brace off, allow your muscles to work a little bit, get up, move around, and then if you need to, put the back brace back on. You should not have this back brace on from the time you wake up all the way through the night, because when you do so, you actually weaken your muscles further. So it should be worn for blocks of time in order to give you the proper support. If you do start to experience any increased pain, if you get irritation, definitely discontinue the use of the back brace immediately and then come into our office so that we can either adjust it or potentially discontinue the use of the back brace. This should be something that gives you relief, and it should not cause you more pain or irritation. If you have any questions, don't hesitate to give us a call or come into the office. We can be reached at 561-619-8160. Enjoy your back brace and get renewed.